Are you curious about the day-to-day optometry operations in the era of COVID-19? Join us in discussing new practice protocols with Dr. Jennifer Dang. Dr. Dang?
I want to talk to you.
Not now, later.
No, now.
Thank you everyone for being with us today. Today we're talking with Dr. Jennifer Dang, who is an optometrist out of Los Angeles, California. Dr. Dang, thank you for being with us.
Hello.
Dr. Dang, maybe we could start out a little bit by, maybe you could introduce yourself, tell us a little bit about your background and your specialty.
I went to SCCO for optometry school. Then I went to the VA hospital to complete my residency in ocular disease. Since then, I've moved back to Los Angeles, where I'm from, and I've worked in various practice settings, private practice, corporate optometry, a little bit with the optometry school, staffing students, and most recently with ophthalmology with cornea and cataract surgeons. But currently, I'm running my own sublease practice, so that's been a lot of fun doing the business side of things.
Oh, that is exciting. That is exciting. Well, and I think speaking of business, I think one of the things that's top of mind for everybody nowadays is COVID. So obviously COVID's had an effect on people's willingness to get out and go see doctors and get the treatment that they need. So maybe you could take a minute to describe how you feel that the eye care industry has been impacted by COVID.
It's pretty much affected every aspect of our everyday lives. It's forced us to adapt, like every business out there. Each doctor has to follow their own city's rules and regulations. So certain laws with whether you're an indoor mall or an outdoor strip mall can affect whether you're going to be able to open your business or not. So it's a lot of keeping up with the rules. It's affected everything. I know some people are doing curbside glasses pickup, things like that. So everyone's getting a little creative. I think the most emotional part of it for us was putting into question whether optometrists and eye care is an essential business or not. So that was kind of, do we go to work or are we essential? So that was kind of a little bit weird for us too, I think.
Well, with what's going on at your practice right now, are you still seeing the same amount of patients? Have you seen that patient load go down as a result of COVID?
It's honestly been up and down. So in the beginning, for sure, it was very quiet. It was everyone was staying home, which is good. That was good. And then people were starting to come out again. It'd come in waves, and then something would happen, and then we get scared again. So it was up and down. A lot of sometimes there'd be a full schedule. Well, not a full schedule, but we have a limited schedule. But it would be a busier day, and then be a lot of no-shows, just people not deciding not to come in. So it would change here and there depending on the mood of people. Also, we had recent protests in the area, so that also kind of added another dimension of whether people wanted to come out of their house or not. So it's been a lot of fluctuation recently. Yeah.
Have you seen a change in the type of patient that's coming in? Are you treating, are you doing the same sorts of exams, or have you seen different types of patients coming in, or maybe people presenting with different symptoms during COVID?
I haven't personally seen anything super strange in terms of related to COVID. Like, I haven't gotten cases that are specifically maybe viral infections but I've been getting a lot of people who just need their basic eye care and they want to get their glasses or their contacts, but their office has closed, or maybe their office completely shut down. So we're getting patients from all over because they can't find a provider, that the one they used to, or certain rules have changed. So it's kind of, we're getting people that aren't just our patients that have been coming from other practices because their practice is closed. So it's kind of like people are just searching for someone that's open to, because they broke their glasses, and I think that's kind of essential too. So, just replacing your broken glasses, even things like that, or sometimes people don't know what's going on with their eyes. There are some health things that come up, like just the red eyes that come up, or vision changes that come up. So I think the most interesting, maybe this might have been related to COVID, was a patient, a young male. he was really stressed out because his in-laws were living at his house, during COVID. And then he developed a central serous retinopathy. So that was kind of, that was a very emergent visit that he needed to be seen. So I think the stress of everything going on kind of pushed that to happen.
It's interesting you say that. That's something I haven't really heard from a lot of other people, but it makes sense. This whole concept of people that say normally you may go to an optometrist that's by your office, right? But you're not going to the office, so now maybe you're searching for an optometrist that's closer to your house, or as you said, maybe looking for an optometrist that's actually open. So that is interesting. Also, something I think you touched on a second ago was just about the fact that a lot of people are working from home and maybe spending more time staring at a computer screen than what they're used to. Are you seeing people that are having issues related to that?
Yes, for sure. A lot of people are wearing their glasses more because they're not going outside. So instead of wearing their contacts like they would when they would go outside to work, they're wearing glasses, they're in front of a screen, probably their cell phone, their iPad, and then after watching some Netflix. So everyone's in front of the screen a lot more. So I've been recommending a lot more blue light blocking lenses to patients. People are kind of aware that they're in front of the screens. My eyes are just a lot more tired. So blue light is definitely something I'd recommend if you're gonna get a pair of glasses and you're not really wearing your contacts as much. I also find that a lot more people are getting dry eye symptoms because of being all the screen time also too. So it's kind of, they probably had dry eye before, but now with the screen, everything's exacerbated.
So when you're talking about dry eye and these patients that are coming in and you're seeing more of them because, again, people are staring at screens and just environments have changed to some degree, do you have any protocols in place that's sort of your standard of care when you're presented with these issues?
Protocols at my office, for sure. As soon as anyone comes in, them and if they have one other guest, they're sanitized and they have a temperature check taken. When they come into the office, everyone has to wear a mask. No, you can't. That's a no exception rule. When they're in the exam room, I have a slit lamp shield. I have my shield. I have my N95 mask. So everything's disinfected, especially like the chair, the high touch areas with the hand rests. We have a UV one to disinfect larger items that you can't necessarily spray, and some of the glasses as well. Everyone has a mask, everyone has a face shield. So we don't have as many of those plexiglass barriers, so we have to just wear it on our heads.
Specifically around the dry eye treatment, when people are coming in talking about the dry eye issues, I know you mentioned blue blocking lenses. Are there any other sort of go-to things that you would go to when you're talking with people about dry eye or other issues that they're coming in with?
Yes, of course. With dry eye, it's not, most of the dry eye causes are from the lid. So I do recommend hypochlorous acid for those patients. And especially with coronavirus going around, having a good disinfectant like hypochlorous acid and something that's safe for the eye is important. So I recommend that for everyone. I use it every day. So if it's something that I use, I definitely recommend it to my patients. Like, I can't recommend something I don't believe in. So I'm extra cautious, especially with cleaning, and with the dry eye, with the cleaning. I think hypochlor is an amazing product, and it's a safe way. It's safe for kids, it's safe for adults. So, everyone should do it. It'll help their eyes feel a little bit better when they're staring at their computer screens too.
What advice would you give to patients who might be averse to coming into the office? And I know some people have some reservations about that. Obviously, we've talked about some of the steps you're taking at your office. What advice would you give to somebody that might be fearful of coming into the doctor's office right now?
I mean, stick with what you're comfortable with for sure. But if you are concerned and you do need to go to the office, you should call your doctor's office, call your local optometrist, call and see what measures they put in place at their office to see what's keeping you safe from coronavirus, and also see if there's certain times of the day that might be a little less foot traffic. If there's the first appointment in the morning, maybe you can come in then and then get in, get out, and then get what you need to get done in a safe way. So call me if you're uncomfortable. I wouldn't say do anything you're uncomfortable with, but I think it's important to know everything that your doctor has done to try to make it a safe environment for you and them.
I think that's good advice too. I think maybe some people are used to just kind of popping in the office, so to speak, and maybe right now that it might be a whole lot easier if you call ahead to make sure that sort of to make a pseudo appointment, so to speak.
For sure. I think we even take appointments for people who want to come and shop so that we don't have too many people in the optical at one time. So that helps a lot too. We do have people walking in, but when we can plan when people want to come shop, that does help. It's almost just like an eye appointment, coming in to shop for your glasses. So that helps too.
Well, Dr. Dang, I won't take up too much of your time. Thank you so much for being with us today and answering our questions. I think that the moral of the story for today's phone call was that, there are issues with COVID. This is a very serious situation, but it's not something that we can't get around if we take the proper precautions. It sounds like you guys are taking the proper precautions at your office. And I think a piece of advice for everybody would be come to the doctor's office, just call us beforehand and see if we can schedule an appropriate time.
Exactly. Keep wearing a mask and wash your hands. And that's it.
Well, very good. Dr. Dang, thank you so much for being with us today.
Thank you for having me.